Hi, this is a waxing video number 3. We're going to be doing brow and lip wax. First, we're going to talk about what we do to prepare before the client even arrives. What you need to do is disinfect your workstation, bed, and equipment using a disinfectant wipe following the manufacturer's instructions. You will check your equipment to ensure that all devices are in safe working order and plugged in to a working receptacle. You will gather clean supplies needed for the facial service, storing in a clean closed container. Then you will dispense products that are needed for the service. And how you do that, you would prepare disposable portion cups for each product with a portion of product by opening the top of the container and ensuring that the tip of the nozzle does not come into contact with the disposable portion cup or tray. Or remove product with a disinfected or clean single-use spatula, something like this, and close the lid to the product and set the portion cup or tray on the tray. You would place disposable table paper on the disinfected bed to ensure that the wax does not fall onto the bed. And then your client would arrive. So you can go greet your client and escort them to the work area. Now, when you do that, you've already washed your hands. We're going to wash our hands again, but just so you know, you always start with clean hands. You're going to assess the client's current style. You'll determine the client's preferences. You'll assess the client's needs. You'll assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation such as lice to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours. You will consult on any known allergies. You'll consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. You'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above, the student moves forward with the procedure. So our client is fine, and so we're going to take her and help her get set up to be waxed. So what we're going to do is take her to the bed. We've given her some privacy, so she's draped. And we've had her lay down on the bed, and then we're going to get her ready to go. So we are going to put on her headband to keep her hair back. And I've got a rolled towel right here that I'm going to place underneath her head for more support. And then I'm going to drape her so no wax could fall on her anywhere while we're working, which is important. And then just so you can see here that we are set up, we have a tray that has, trash can back a little bit so you can see more of the tray. What we need to perform the service. So we have all of our products in our disposables. We've got our waxing strips. We've got our single-use spatulas, tweezers, and scissors, cotton rounds, a pair of disposable gloves, tissue, a mirror, hand sanitizer, etc. So we're ready to go with our service, except this is the point in time now where I would need to wash my hands before I even start and apply gloves, etc. So let me just try to see if I can get this on the front of her a little bit there. So I would find the sink, locate the sink, and then I'd turn the water on and I would wet my hands. I would put a coin size amount of liquid hand soap and I would wash my hands thoroughly, starting with the palms down to the wrists. And then I'm going to wash the back of my hands all the way down to the wrists. I'm going to wash between my fingertips and between my fingertips and thumbs. I'm washing those fingers thoroughly. I'm going to wash the backs of my fingers thoroughly, my fingertips and my nails thoroughly. I am going to wash like interlocking under that water for at least 20 to 30 seconds. I am going to wash my thumbs really good. I'm going to wash my wrists. And then once all of that's complete, I'm going to rinse thoroughly underneath that water, making sure I get all the soap off. I'm going to grab a disposable paper towel that's close by, and that hand is the one that's going to turn off the sink. And then I will dry. I'm going to dry everything perfectly. And when I'm done drying my hands, I'm going to throw the disposable paper towels away. And then I'm going to find my hand sanitizer to finish my hand wash. And I am going to completely go through all of those steps with my hand sanitizer, making sure that everything gets nice and dry, because after this is dry, I have to put on disposable gloves. And so if your hands are wet, that makes it not so much fun. So getting this all dry, I am going to apply my gloves. And then I'm going to analyze, I'm starting with the brow first, so I'm going to analyze the direction of the hair growth and see what needs to be removed. And that's important because you're going to apply the wax in the direction of the growth, and then you remove the wax away from the direction of the growth. So I'm kind of looking here and just figuring out what I need to do for her brows. We've already discussed her style and her preferences, so I'm just kind of looking at what we need to do for hair removal. And then I'm going to clean the area, a little antiseptic clean. And then I'm going to thoroughly dry the area, because the last thing that you want is for the brow area or anywhere you're waxing to be wet. It needs to be completely dry. And before I would go to her with wax, I need to test the wax temperature on myself. So what I'm going to do is get some wax, and then I'm going to test on the inside of my arm the temperature. It feels good. And I'm going to remove it. And I think it feels pretty nice. So we're going to get in here and start mixing.